And then all of a sudden, here comes, me knocking in the door, being like, "What's happening?" Yeah. And you're like,
I'm just adjusting. My bad.
Sorry. Hey everyone, we've got our first guest on Get Naked here on episode 10. This is Amanda from Midlands Family Chiropractic, and we are so thrilled to have you today, Amanda. Where can people find more information about you?
So you can find us on our website, www.midlandsfamilychiropractic.com. We have a Facebook page as well. You can call our office, 803-772-3300. We'll be able to answer any of your questions.
All right. Now let's get into this.
Yes.
Hey, everyone. Welcome back to Get Naked with me, Erin Plott, and my strong hand,
Dominique Thomason.
Very nice. And our amazing special guest, because it's episode 10. Ooh. So we told y'all we were going to have a special guest. And so we have kidnapped this poor person off the street and forced her to come in and promised that we would touch her naked, afterwards. I can't wait. So who are you?
Random lady.
Hello, thanks for picking me up. I'm Dr. Amanda with Midlands Family Chiropractic. I own a chiropractic office in Irmo with my brother, Dr. Matt. We've been open for about 4.5 years now, getting less naked than you guys get, but still having just as much fun, for sure.
That's good.
Only the special clients get
only the
naked.
Special. That's when they have to adjust
20.
Special bones.
Let me see that special bone you got.
Right? I'm sure you have people who come in and ask you to adjust their special bones. Oh yeah, we certainly do.
Yeah,
super fun. It's
their penis. If you guys aren't catching our drift, it's their penis.
If you didn't know, that's exactly what they're talking about. Bone. It's not the inner ear. It's the penis. So it's been a minute. I stepped away briefly. I had surgery. They took out all the baby making apparatus. So now I'm supposedly going to be happy for the rest of my life. I'm not sure.
Is that a guarantee that they?
I don't know. I mean, she seemed to think that was going to just set me, you know. And I'm like, all right, so no more. Yeah, I was like, okay, that's cool. But while I was out, I was at home and really, really bored. So I spent a lot of time with my cat. And for those of you who don't know, I have this cat, Chloe. She's super poofy and kind of chunky looking until you get her wet. And then she's like really skinny. It's kind of funny. But I call her affectionately Murder Mittens. She's a cat. I mean, they're all floofy and they're cute. And then Murder Mittens. And I was like, oh my God, that's going to be our new thing. It's not massages anymore. It's not massage mechanics. It's murder mitten massages.
Murder mitten massages.
Yeah, I mean, that's a totally great marketing thing.
I think
right?
I got to reschedule my massage today.
You're like, and I don't think I want to participate in that.
What's that cancellation policy? Yeah, tell me about it.
But yeah, I think high on Oxy, and I thought that was a really great idea. And Eric came home, and I was like, babe.
I just imagine like Wolverine claws, like.
If Addison had her way, we'd all walk around wearing like Freddy Krueger gloves. Oh, that would be a whole thing because she's obsessed with horror movies, and it's a little disturbing. My 11-year-old. She asked me in the car today.
Laugh, murder.
Yeah, I mean, like live, laugh, murder. But she asked me in the car today, super random question, and my kid does this to me all the time before I've had coffee, and it's like diabolical. She fucks with my head, and she's like, "Mom, is 20 a big number?" And I was like, trying to figure out where the trick is, right?
Relative.
Because this is like, and I'm just like, I mean, I don't know. It kind of, you got to figure out the context, right? Because like 20 doll hairs, is not a lot of doll hairs, but like 20 murders.
That's a lot of murders.
That's a lot of murders, So I was like, I don't know. I need context. And this was no shit her face. And I was like, I'm sorry. You can't ask me questions like this before.
It is what it is.
I mean, she's lucky I wasn't like, $20, not a lot of dollars, 20 wieners. I mean, that's
it's a lot of wieners.
Kind of hoeing out at that point. You can't say that to an 11-year-old. You get in trouble.
Yeah.
It's not a good
because
thing.
then, you worry about her taking that back to school and then be like, my mom told me about 20 wieners. And they're like,
I've honestly never really thought about her taking stuff back to school because she is 100% a different kid at school Like, I go and I meet with her teachers, and they're like, oh my God, she's so quiet. She's so sweet. She does all these things. And I'm like, this asshole?
My child?
My kid? Like, I need to do better. Like, she's not repping the way she should. She needs to represent better. But, you know. So Dom kept the office running while I was gone. Nothing burned down.
You're welcome.
She didn't murder mittens any of the people who work here, which
Mostly
is
staff.
shocking.
Wanted to.
Shocking, you know. But I appreciate that, you know. Thank you. I didn't really have to worry about that too much. And Amanda, of course, was here a good bit, you know.
Yes,
like,
I was.
she. I like to think that she was checking in.
I was.
And making sure because they run a responsible business. She's like, this is the way it really needs to be done. This is client retention, you know. But tell me a little bit about, you know, getting to the serious part of the podcast.
Oh, that part. Okay.
Yeah.
Ready.
Like, you
I'm
know.
ready.
So tell me a little bit about,
She said I'm ready. I'm ready. Okay.
Yeah. All right.
So y'all, obviously, chiropractic, y'all are doing, you know, structural restructuring, essentially, you know, bones, joints, things like that. What are some of the things that set you apart from your typical average, you know, crack and grab?
Yeah, for sure.
Is that the word I'm looking for?
grab.
Crack and grab. I was going to say crack and run, and somehow
the
that
grab?
totally, yeah, exactly. like I feel, well, grab and crack. I don't know. Maybe.
Other way.
Yeah, that went way, it's been a minute, guys. You're going to have to bear with
I like
me.
it. I like it. Just getting new terms to talk to my
Right,
patients.
right.
But I like it. I like it.
All right, take it back
Dumb
to
it
Matt.
down for them.
You're going to
They're
take
like,
it back to
yeah.
Matt. All right, so this is the grab and crack. It's a new technique.
That's right.
We're going to use it.
But Erin really likes the crack and grab. So
Right,
got
so
it.
we're going to name it after her.
Yeah,
This is
perfect.
the Erin.
It's like a menu board. I'll take the crap.
I'll take the Erin.
take the
What is
crap.
that? What's the Erin? Hold on. Murder mittens.
Yes.
You know.
Yeah, so biomechanics, that's huge.
Okay.
I think that's kind of what you were talking about
Yeah,
with the
yeah, we
restructuring.
talk about that a lot.
We like to call ourselves biomechanics specialists
Okay.
because we have a 3D foot scanner, we have x-ray machine. So
Okay.
by the time you leave and come in your second visit, we sit down with you and we tell you everything.
Right.
Because
so
it's important.
you do from basically
Head to toe.
bottom of the barrel all the way up, you
Yep.
know, trying to figure out how everybody's
Yeah.
moving, walking, life.
Exactly.
works,
I
all
watch
that.
you walk in the office. I watch you walk out the office. It starts from the minute you walk through the door. But the first visit's important because that's information gathering.
Yeah.
Figuring out what's going on with you. You can go down the road to other places and you walk through the door and they're like boom, 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 and you're out your
Crack
way.
and grab, you know.
Yeah, they crack and grab.
Right.
Yeah.
And then bye.
It's
you know.
the same treatment
Hey,
on every
lady.
single person.
Every
that walks
Right,
in.
right. And I mean, you guys, I know, because I know Dominique goes and gets adjusted by y'all and everything. And I've talked to Matt a million times about stuff that y'all do. And y'all have got a lot of other things that you do aside from just the manual adjustments.
Yep.
You know, lasers. You've got various different equipment that you
Yep.
will
Pew, pew,
use.
laser
yeah,
beams.
yeah. Pew, pew.
We have ultrasound machine. We have
Right.
a whole stretching area as
Yeah,
well.
that's awesome.
We do a little bit of muscle work because you guys know if your muscles are tight, those joints aren't going anywhere. So all day long we
Right.
talk about that. Patients come in. It's important.
I
It's
did a
important.
whole interview with Gary David on iHeart this past weekend, talking about how muscle injuries and things like that, how like as you're recovering and everything, typically what a muscle will do is it tightens up around the joint that if the joint's injured and everything. And you get people who come in and like, my back hurts. And it's like, oh, well, what's going on? Oh, well, like my L4 and L5 are totally, you know, screwed. And you're like, well, that's why your muscles are tight and your back hurts. Like, you know, but, and I know y'all get a ton of stuff like that, you know.
All the time.
So tell me some fun things. Tell me something.
Fun
what
things?
is probably like what's one of the funniest questions anybody's ever asked you? We get a lot of weird shit because we see people.
we get a lot
naked.
of, do you feel that? It's like, no, I'm just pushing on this because it,
Right.
just for funsies,
Just for
like just to
funsies,
see
yeah.
what happens. If I push on this, does your leg go like that?
Like, oh, this is fun. This is fun. I think a big one is we were kind of laughing about it earlier that people don't know that they've had surgeries before.
Oh yeah.
That's a good one, and they're like, "Oh no, I'm good." And then I take an X-ray, and there's a big metal block in their neck, and I was like, "Where?
That doesn't
where
count.
were you? Where were
I
you when
was born that way.
happened?"
Thank you.
where
I'm
were
half
you?
bionic. Like
Yeah.
it's
Yeah.
a thing.
Yeah.
No, we get that a lot. We also get, the people who, funny thing that happens with us a lot, even before they get in, is they always are like, what if I fart while I'm on the table? And it's like, well,
It's her favorite.
You're anal air and you are like covered. So it's hopefully
I was
trapped
actually
in
really
there.
pumped for this podcast because 3 weeks ago was my loudest fart of my chiropractic career.
Really?
It was a
wow.
good one.
Wow. I can imagine because you're like abruptly pushing and like popping and moving.
Yeah.
And I mean, have you ever had anybody pee on your table?
No.
I
Thank
have.
goodness.
I have. You're not missing out on too much. The spontaneous
No,
the spontaneous
on
golden
aisle two,
showers, those are extra. So
wow.
there's gonna be an upcharge for that cleanup thing
No.
because I'm gonna have to replace some things.
No, thank
She's
you.
probably gonna kill me, but one of our very good friends texted our group chat and was so embarrassed, but she was
I think
also like, she thought it was really funny. She was like, "You guys, I farted when Amanda adjusted me."
And like, I just had to tell somebody.
I had to tell somebody. It's like,
And I could just like, in my head, I could see her like, "Oops, sorry, that was me."
that is hysterical. I love it. I love it. Now, are there certain things that people come in specifically for, or is it mostly like just pain symptoms? Do people come in like needing y'all to cure certain things, or
That's more rare. It's more I am in a lot of pain. I mean, my favorite is kids to work on because it's like, let's get them set up before that pain. So that'll be earaches. We do a lot of sinuses.
Okay.
A lot of sinuses. That's a good one.
That's something I think people don't realize, that like chiropractic adjustments can help. And, we get people all the time too who are like, my sinuses are all, and then laying on your face,
Yeah.
everything does. And you can do a lot with the lymphatic drainage of it, but the actual adjustment of, their jawline and their cervical spine is
They stand up and
crazy
they're
how
like,
that works.
I can breathe.
Yeah. It's like,
it's a
oh,
release.
guess what? It's because your neck was doing this thing,
Everything was just stuck. Yeah.
So have you ever had like an x-ray go very, very wrong where like you saw things that you, like hamsters? No, I'm kidding.
Unfortunately, no.
She's like, unfortunately, I know.
Little hamster.
I asked that because I went and got x-rayed once at a chiropractor, and this was after I had a surgery to give my brother one of my kidneys, and they did an umbilical hernia repair while I was in there, and they told me they were going to. It was like a little 2-for-1 kind of thing. It was great. I was like, okay, but they didn't use a mesh. So apparently they just used a shit ton of staples, and I didn't know that. So the chiropractor's like looking at my x-ray and he's like, what happened? And I'm like, what are you talking? I'm freaking out. I'm thinking like my IUD's over here or something. I'm like, what?
We see that a lot.
Yeah. And he's just like, what happened here? And he like puts it on the thing, and you can see it's like just this sea of, it looks like I got shot with like a shotgun. And I was like, oh yeah, no, I think those are just staples. Yeah, those are staples. And he's like, what did they do? Like, choo.
Yeah. I think too, like a lot of times people go in and they think like, are these really my x-rays? Like, how will I know if it's me? I'm going to open my mouth just a little bit so that my teeth aren't touching. So when I look at the x-ray, if the teeth are touching, like, I know it's not mine. I'm like, you're a crazy person.
I've had a man before be like, is that me? I'm like, yes. Like,
yes. No, it's me. Don't you see the...
Like, oh my bad, those are boobs. That's not you.
Right.
Like, I don't...
People are nuts though.
Yeah.
I mean, like I can imagine that happens a lot, and that you get people coming in asking like all kinds of crazy things. Dominique told me a story.
Yeah.
That you told her, apparently.
Oh, which one?
What me?
I thought about me. I thought you were talking about your
No, it
x-ray
wasn't
day.
about Dom.
Okay.
Yeah, my x-ray day was a lot of fun because it was the first time that they had really, I guess, I was 80 pounds heavier. And so like trying to get through, Matt was like, I don't know what's wrong with this thing. He had to call the guy. I was so
We were
embarrassed.
trying to like figure out the x-ray machine and
you
try
kidding?
figure out
I was
the
like,
settings.
but my favorite was later when they did their one, or no,
It was like an open house.
it was an
we
open
did,
house,
yeah.
yeah. And it was like a week or something after you guys like opened, and it was, and we were standing there, and it was my x-ray, but they had the name covered, and someone leans over and he was like, that's a woman, because you could see my side boob,
Right.
and I was like, I'm pretty sure that's me, and he was like, no, it's not, and I was just like, yeah, that's me. And he was like, I'm so sorry.
You were just staring at her boobs.
It's like, well, at least you weren't like, that dude's got a huge, like, you know, I mean, like.
See that too?
Yeah, so that was really funny. But recently I went back in because my elbow's been giving me issues. And so they pulled up my account and like looking at the x-rays, like from when I first got x-rayed to now, I'm like, wow, you can see every little roll that I had. Like,
oh yeah, you see those rolls.
So that's where she was going. Mm-hmm. But what Erin's talking about was the person who asked if chiropractic care will help with her queefing.
Oh, yes.
So will it? I mean, and I was that
followed up.
That
I never
piqued my interest. Like it really did.
Up.
I was like, she said that, and I was like,
does it?
But does it? You know,
I don't know.
I mean,
unfortunately, there was three.
Oh God! Wow.
Yep.
Huh.
It's a random.
That's just
something
random.
Individuals. But, it's very random.
And Scott's over there like dying. He's laughing. He's trying so hard not to like just fall off the chair.
Yes.
And it's funny to me now that Scott's laughing because queefing is so very unique to women. So very unique to women. It's just one of those very delightful things that we get to deal with along with the multitude of other bullshit that comes along with being a woman.
And in my mind, I was like, how do I make this like biomechanic?
How do you make this scientific?
Like, you're like a little twisty, your muscles are really tight.
I kind of feel like if your pelvis is tilted a certain way, it's going to make all the air divert.
And that was the loudest
through
fart
your labia.
she just had in her office.
Follow that up.
But I mean, it's like, does the pelvic tilt matter? Like, I don't know. But she told me that, and after I quit laughing because I about like sprayed shit out my nose. It was ridiculous. And then I was like, oh, now I'm interested. Like, can it? I don't know.
Yeah.
And then you're
So I'll need to follow up.
I haven't followed up. You're going to need to call her and be like, so.
Just like a quick question.
I have a quick question.
Research.
Have you noticed any, lack of queefing lately?
Yeah.
Have you dropped in your frequency?
Yeah. Oh man,
I love it.
It's stuff like that always makes me chuckle,
right?
Because it's like not stuff that I would expect someone,
right,
someone to ask.
Just like straight up ask, you know. And I love that because it's not, hey, will you touch my wiener or anything like that. You know, it's not gross in that way. It's just one of those things that you're just like, I didn't know that.
Luckily, usually they're laying face down with those questions,
right? And so they can't see your face
to face, and I was just like,
and you're just like panic. I don't know. I feel like that would happen if like a judge is over there like, do you swear to tell the truth, the whole truth, nothing but the truth? And they're like, no. And he's just like, what do I do?
what happened?
Like, somebody help me.
What do we do?
I need an adult.
Yeah.
I've always wondered if anybody's ever done that in court.
Yeah.
That would be pretty interesting.
I mean, I feel like you go in and you hear some interesting stories because it's all open, adjusting area.
Oh, yeah. Oh, golly.
Yeah, we do that for two reasons. One, what you guys run into all the time. It's a lot of liability. It's like, ooh, she touched me here. And it's like, nope, I have a male staff. I have a female staff.
There's all the people. They witnessed it. I did not.
But then to the fact,
cameras.
Yeah, we have cameras. Like, it's... and nobody has ever complained or said anything. Because on the first visit, I'm like, if you have anything you need to talk to me about, we can go in that room.
Right.
If you're
we can step in.
We can make it work.
Make it private. And that drives me crazy because, like, we can't have cameras. Like, we can't do that. And, I mean, sure, we could have a practice where, like, everybody stays closed. Like, we could specialize in rolfing or something like that. Or Thai work where everybody's on the floor on mats and they're fully clothed and stuff like that.
But that's not what you do.
But that's not what we do.
No.
And those, while they can do amazing things, there's still something to be said for manually being able to reach the sides of people's hips and things like that. And yes, you can do that through clothes. Everybody calm the fuck down, you know. But it's not the same. You know, it's just not the same. And, you know, I would love to have cameras. I would love to have cameras that are just turned off. Like, I wouldn't even care.
Just the noise.
Just to have them up there. Just be like, we're watching you, asshole. But you can't because even that, it's like people would be so uncomfortable. And, like, I know I'd be uncomfortable if they're like, how do I know it's really off? I know there's no light, but this might be one of those weird AI ones. Like, you move and it comes on or something. I don't know. But it's funny because I was reading an article the other day that ABMP had put out. And apparently the owner of Hand, Foot, and Stone, like the corporation, came up with this device where it attaches to the bottom of the massage table. And it's a panic button. The therapist can reach it. or the client can reach it. So it's like a mutual panic situation. So if the client says
who can hit first?
Right. It's like
Family style.
It's like Boggle. Slapjack. No, so if the client is like, hey, touch my wiener, the therapist can be like, no! And basically what happens is it sends a signal, either a tone or light or whatever, to the front desk, and the person at the front desk is supposed to immediately go to that
Hulk
room,
mode?
like hit the door, like knock once and not even wait, just walk right in, right? So that you can like catch them on whatever they're doing. I don't know, but like it's super weird because I'm like, okay, first off, I have questions.
I have a lot of questions.
I have questions.
Now I just have
first
a lot of
off,
questions.
First off, what the hell? Okay, if any of you have ever been to, most massage therapy practices have females, you know, like and working at the front desk and things like that is usually a chick. I have never seen a chick that is gonna bust up in a room and like do something.
Have you met Dee Dee?
Effective.
Like,
I mean, like,
hi, hello.
Obviously.
Why do you think this office kept running? No, I'm just kidding.
But this is what I'm saying is like you see the front desk and like what are they gonna do really outside of just coming into the room? Which if things are copacetic, then that's one thing. If it's just somebody who, I'm uncomfortable, I'm going to need you to leave, whatever, that's fine. But if there's an actual physical altercation happening, like, I mean, unless you're busting up in there with like a fucking Uzi or something, you know, baseball bat, like, I mean, and maybe that's what we're going to do here, just so y'all know.
I feel like I'd be like
so
phone out, recording, like, I'm ready.
Right. I'm recording this, you know, with my baseball bat.
TikTok famous, baby.
But so there's one issue there, but also here's my other issue. If you know that the button is there and your client knows that the button is there, how is it supposed to be like an emergency button in that regard? You know, because like they know that it's there and that you're going to hit that button. And so they know how far they can push. And then, somebody busts in and you're all covered and like, I don't know what's going on, you know, and you can't prove it's he said, she said, whatever. And I get it. It's so that people can be like, there's somebody else there. Safety in numbers. Now, if you're asking somebody to leave, they're much less likely to get belligerent.
Yeah.
Or are they?
Yeah. Or what if you accidentally push it? Like, you know, you're like, let me adjust
let me
this.
adjust this. Or
somebody's
somebody's like fucking with their arms. You know how people are like, I'm going to put my arms here. Now I'm going to put them here.
She
doesn't
put them here. Stop
you know?
moving during a massage.
And so it's like, you know.
Because you dig your elbows into my hips.
And then all of a sudden here comes, you know, me knocking in the door being like, what's happening? Yeah. And you're like,
I'm just adjusting, my bad.
Sorry. You know, so it's just one of those things like, I get it. And it's a good idea in theory.
Yeah.
How do you know what room it is?
You have like
how many buttons do you have? And are they
like the dressing rooms with the little light comes on when you have a question?
It's like green means good, red means bad.
Red definitely means bad, especially in Holland. Red light district. Not a good look over a massage room. Yeah, it's going to need to be stranger danger.
Blue massage mechanics. It means bad.
You know, and so I was thinking about it because I was like, because right at first when I read it, I was like, that's a great idea. Yeah. And then, of course, rabbit holed it and was like, I feel
too many holes in this.
There are a lot of issues with that. Yeah. Whereas,
I mean,
you know,
like
I just feel like a quick karate chop to the sensitive organ area is effective.
Yeah, and I feel like with you guys, it's really easy because you have so many people like walking through, like you have other staff, so it's not.
They call it the barbershop a lot of the times. I'm like, I think it's a good thing.
Yeah,
I don't know.
But it's also like, you know, you very rarely are there by yourself with a patient. You know, like it's very rare. Yeah. And even here, like you might not be by yourself, but you're by yourself. Yeah. You know, because you're in a room with somebody. And it's just one of those things that can be really, really, you know, kind of scary.
Because you don't know what's going on. Like I was here one day and Lindsay was here as well. And she had a client. And then I heard crying. And I was like, is that Lindsay or the client?
Is somebody hurting her? Like, what's happening?
And so I'm like, I'm massaging, but I'm also trying to listen for cues to like make sure that everything is okay in the room next to me. Right. And come to find out, like the person on the table had like lost her parent of some kind or a grandparent, and so she was like very emotionally not okay.
Right.
But she wanted to come in for the massage because she was overly stressed and just like being on the table.
Yeah.
Her head was like, okay, this is the first time that I I have time to think.
And that I've relaxed. And like the minute your body starts letting go of that tension that's kind of held you together for a while, it's just, it all hits you. You know, like I've had men fall out and just freak out. And you're just like, I didn't do anything, dude. And then they're like, no. And then they tell you and you're like, oh, okay, you're fine. It's cool. Do you
didn't
want,
know
like,
we signed up to be therapists.
Right.
We have some guys that like Dee Dee said, we're open adjusting, so you hear it all. And some people get off the table, and there's people sitting there looking like,
what is happening?
Right?
Oh.
Like, holy
so then
crap.
I walk over, I'm like, anything you'd like to talk about today? Like,
right.
you good?
Like, are you good?
Yeah.
Is everything
You're hurting
right?
physically, mentally, what you need?
Did this trigger some sort of thing?
Well,
like,
they see it a lot because people come in with these really bad issues. And it's like, I've been to 18 chiropractors. I've done, you know, gone to the surgeons, the doctors, and then it's
nobody
like,
listens.
Nobody listens. And then first adjustment, they're like, for the first time in 18 years.
Right. They feel relief, you know, and if you've ever dealt with chronic pain and things like that, I mean, it really is a huge deal.
Oh, yeah.
You know,
we get hugs, we get tears all the time, but like, that's why we do what we do.
I like the people who are like, can I hug you? Because I'm like, bring it on in, big mama, you know, but it's weird when it's just somebody just grabs you because I'm like, I don't do this. Like, stop. This is off limits. Like,
they get a lot of baked goods.
Oh, yeah. People cook for us all the time.
I get so jealous. They did a pound cake competition because someone brought it in and I was like, oh my God, that's so good. And they were like, pound cake competition? And I was like, can I be a judge, please? And then they didn't ask me. I was so upset.
Rude.
There wasn't a lot of
canceled. Canceled.
Yeah. I was like, what? I was like, you can't have a food competition and not invite Dee Dee Poops.
Well, and if you think about it, Dee Dee Poops always welcome. If you think about it, we see these patients a lot more frequent. A lot in the beginning, and then you taper them off some, but you learn about them. You learn everything.
We've had a few people bring food. My favorite are the empanadas.
Ooh, that sounds great.
Yeah. Oh my gosh.
Haven't gotten empanadas yet.
That is 100%. If you bring food to us, we're like, when do you want to get on the schedule?
Yeah.
We
when
will
would you like to come back?
Like bend over backwards for that.
Lunchtime?
Because that's like, yes. I mean, like,
I got a lunch break in an hour.
or right around 5 because I don't want to cook dinner tonight.
That's right.
Either one.
But yeah, no, that's one thing is like just the gratuities, if you will. Like people are always asking like, oh, what do I tip? Like, how do I tip? And I know you guys don't necessarily take tips and everything. And I've always looked at it as like, it's sort of built in. Like, I mean, if people want to leave extra because they appreciate the work that you did, that's always wonderful. And that's fine. We encourage that. But if they don't, it's also not a huge deal because we have a lot of people that come for therapeutic reasons. And so they're looking at it more as like a physical therapist or as an alternative health professional, not necessarily a service or anything like that. So they kind of are like, meh, and I'm like, we will accept food. Yeah. Candy, your mama's like recipe for vegetable soup, bring it. I'm good for it. I'm such a fat kid. Like, bring it. You know. Mother's Day is coming. Oh, fuck. Y'all don't have kids, do you?
We got dogs.
Oh, yeah.
That makes us mothers, too.
Did you shoot that dog out of your vagina? Did you?
I tried real hard.
Done real hairy.
Listen,
hold on.
I spend probably just as much money on these damn dogs as you do children.
All right. True. I respect the fact that your dogs are your babies. Yeah. I do. And I respect
and the only thing you had to say was the baby coming out of the vagina. The rest is fine.
And the rest is like, you
just
know.
That part. Okay, cool.
And I respect all the dads who are moms and things like that. But man, it is fucking Mother's Day. I shot a watermelon out of my fucking lady garden, and it used to be nice and trim, and it was like an English garden, like box hedges and all the things. It was great. And then that watermelon came and wrecked that shit. It took years to get it back. Like, so I deserve a damn day. Okay?
Yeah, you do.
And I respect y'all's motherhood for your dogs, but there's probably a dog owner day. All right? Like,
is there?
I'm just saying.
I don't know if there is. I know there's like specific breed.
Really?
Breeds.
There are?
It's like Corgi Day, National Corgi Day. Well,
I've got to find out what
Queen's dog.
I don't know. I got to find out what National Beagle Day is. Then
I'm sure
everybody walks around going brrr.
Yeah, it's perfect.
That's fine. Yeah. You know, on Corgi Day, do you do the Corgi dance?
No.
Oh.
No. I get.
She does the Corgi dance every day.
Every day.
Wow.
It's every day.
It is every day.
Yeah. Amanda has a German Shepherd named Odin.
Yeah, he's a big boy.
Yeah.
I love that name.
He is petrified of
my
her corgis.
25-pound corgi.
He's 103.
I'm sorry.
Yeah.
One of your corgis is an asshole. Like, I mean,
he's not as petrified as that one as the other one.
That's not the one he's afraid of.
That's because he's upfront about his assholery.
100%.
You know,
That's true.
I
Yeah.
mean,
He
that's
knows
the thing.
what to expect.
It's
The other
those
one-
surreptitious ones where he's like, I don't know what's about to happen here. This bitch might,
I think the biggest
snap
thing is
on me.
because she tries to like chomp his butt, and he's like, I don't like
Yeah.
that, so he like runs away real
Roscoe
quick.
gets that way around dogs that are bigger than him, like, because he's, yay high to a grasshopper, and he'll like run around, and dogs, they all sniff each other's butts and things, and if one comes near him, he like tucks tail, and he's like, no, and I was like, Mama taught you well, that's right, you don't let
danger.
you don't let strange dogs sniff your junk until you get to know them better, all right?
That's right.
That's just the way
That's
it
true.
is.
Yeah,
That's
that
the
is
way
true.
it goes.
But
One of these days, we're going to have a little lesson for your dogs.
it's we're far past that point. But Mother's Day is Winston's birthday, which is my
is
asshole
it
dog.
really?
So it is going to be a day I celebrate, ma'am.
Aw, are you going to get him like a little cupcake?
I might. He's got too many food allergies.
Carrots.
So
Carrot cake.
yeah, carrot
Of
cake.
just
It's just shredded carrots.
Pam will
mixed
make
in a
you
bowl.
something.
We just switched him over to a raw diet, which is absolutely disgusting.
Yeah.
So your dog eats probably better than I do as far as like health
Yeah.
wise.
Stinky though.
But it
Gross.
makes him stink, which makes me think about clients.
I was just about to say, do you guys have stinky clients? Because
100%.
I just don't understand like how you do not properly wipe your butt. I just don't get it. Like it doesn't not burn?
I feel like some moms
like,
fell down on the job there. I feel like some moms fell down on the job there when
But
there
do
was
you
that
not, like,
lesson.
You're like, ooh,
I feel
I need to go.
gross.
I need
Like-
to go clean that up.
Clean up on aisle 2.
Yeah,
We gotta put brown.
code brown.
But
code
it's
brown.
like, have you ever felt like I should keep wet wipes in my office? And it's not because people shit in the trash cans. It's literally because people come in and you're like,
I have wet wipes in my bathroom.
do you?
Oh yeah.
I mean, in my office,
I
like
obviously don't
in
use
the
them.
office itself, like in the room.
Wipe
I'm
yourself
sorry, you're
down.
gonna need that. I'm gonna step out for a minute. Clean that up. Or like they farted so hard that you're pretty sure they shit themselves, and you're just like, I'm gonna offer this and step out of the room.
Do what you
know,
need.
like
There's a
just
bathroom right
take
there.
care of that.
Yeah.
You know.
That's a big question we do get on X-rays. They're like, "What is that?" I'm like, "Full of shit." That is,
Yes,
that
that
is
is
poo.
you are
That is your
quite
poo-poo.
literally
I was
full
like,
of
you
shit.
really had to go before we took this X-ray. Yeah, that's always a good one.
Now I understand why every time I have to get an X-ray, they ask me to use the bathroom first.
Yeah, you can see better.
Yeah.
Yeah.
Interesting.
If you're full, you
never,
see it.
There
It
you go.
never even occurred to
Bing,
me.
bing.
Yeah.
Yeah.
Oh.
If they swallowed anything weird, like that'd be fun to see on the X-ray.
That would be
If they
fun.
swallow it or
They insert it.
That's one thing.
Oh,
We've
we
got.
have
I'm
not
sure
run into
piercings.
that.
You probably see
Oh,
that.
yeah.
Right?
Oh yeah, we see
Yeah.
piercings.
We get a lot of physicians and anesthesiologists and nurses and things like that who come through and are clients of ours. And I would say medical professionals and police officers are some of my absolute favorite clients because the stories that they tell. I'm like, I was talking to one, he's an anesthesiologist, and he was telling me about this guy who came in, and they're like, it's code B2, which is some sort of like terminology that they use, that, and it's something is in their butt. Like they have put something foreign in their butt. And and I was like, okay, what was it? Like,
Yeah,
I mean,
like,
you
please
have
tell
to
me.
ask,
Please
like
tell
you
me.
have to know. And it was a hamster. And the way that they found out was because it came out while they were like doing some sort of exam. And I was like, okay, if I'm working on a person and something comes out of their,
If you're working
like an animal
in a
comes out.
hamster
Were they just like, "Hi, buddy"?
I mean, I don't know. Do you catch it or do you let it go? I mean, I don't want to catch it. I'm not going after it.
You let that poor thing go.
That thing's been
have a better
traumatized. Like, run free, little poo hamster. Like, I don't know. It's first off, who the hell?
I've got so many
Why do
questions.
you weird ass people do things like this?
If you do
Why?
that, please comment so I can ask you all the questions
If
that I
you
have.
yes,
Yes,
like,
please.
comment, subscribe. to us on YouTube, and because we want to know all the things.
Yes.
Like, what possessed you?
So many questions.
First off, did you have to lube it up?
Did you lube the hamster up? Did it go in
do
on
you
its
put
own?
treats in?
Yeah.
To what do you do? I don't want to know. I do. I want to know. I'm so weird.
A tool
tunnel?
that helps,
hamster tunnel?
like a hamster tunnel, like
a speculum?
but for your butthole.
I don't know. Oh, there's so many questions.
I really hope somebody answers.
I really
Yes.
do hope
Please.
that somebody,
Yes.
not hopefully an active client, but like, somebody in another state far, far away. But like all kinds of things.
Yeah.
Bottles, light bulbs, which, okay, that just seems
Ow.
dangerous
That is so
to
dangerous.
me. Like,
Keep the
that's
glass
just
away.
a bad idea, Various different vegetables. Hot Wheels? Like little racing cars, all kinds of stuff, and I'm just like,
That was an accident.
why? Yeah. Oh, they tripped and fell on it, and I'm
It
like,
was sitting straight up on the floor.
I feel like for it to pierce your undergarments and actually get into your body, you would have had to fall from a very great height with great precision.
They might have been naked though.
I would be such an
barriers.
asshole if
I don't know.
if I worked in the ER. I would be such an asshole. I'd just be like, yeah, okay, you fell on it,
Don't
sure,
believe you, but okay. Okay.
I'm like, yeah, you're a hoe. No, okay. It's like you just nasty.
Yeah. I feel like I fall down like the TikTok rabbit hole. She knows. I sent her a bunch of TikToks, usually dog related.
Well, I mean, during my colonoscopy prep, you kept me very entertained with all the stuff you sent me, so that was good.
But I find that I'm on a weird side of TikTok every now and again where I'm like, a lot of times it's like dogs,
Weird talk.
and then it's like, that's weird. That's weird too. But recently it's been a lot of like the chiropractic adjustments and like where you put the strap around the head
and you're like
pull.
hearing it, and it's like,
Yeah.
oh,
And obviously like they have
internal decapitation.
Yeah, but they have
Finish him.
the like the mics on, so it sounds a lot louder than it actually is. But I mean, obviously you guys don't do that.
No, for
So-
many,
Y'all don't do wire
many
straps?
reasons.
Yeah.
No, because a big thing is your muscles are really, really tight. Your joints are really, really stuck. There are nerves; those are really important. Like,
Those
they're
are-
really
yeah, that's a
important.
little-
So you pull that bad boy, and that thing's gonna get stretched, and you really should not stretch a nerve. There's just. If you're looking for the appeal of the pops and cracks and pulls, you're not really looking for the appeal to feel better. You're just looking for the
Yeah.
TikTok
You just
trends.
want the right.
Yeah, and
I feel
if
like
you have to be strapped in for an adjustment,
right,
like,
that's
I'm
not.
okay.
I
I'm
feel like
okay.
that's not a good fit.
It's not a good look for
No.
what we're doing.
It's like if you have to be
but-
strapped in for your massage, you're not getting a
Yeah,
massage.
don't strap me
not-
in, please.
that's not-
Stop moving so much.
I'm sorry. Okay, I'll do better.
Oh
I'll
my
do better.
goodness.
She said, "No, we don't have to do that. That's okay. We can be done now."
We can
No,
be done
don't do
now.
that one.
But it reminds me of all the people who come in, and for us, it's the IT band. They come in and they're like, "I need you to loosen my IT band," and I'm like, "No, you don't." And they're like, "Yeah, it's really
don't.
tight. I need you to loosen it." For those of you who don't know, it's that tendon that goes from here to here, and it if it does get loosened, takes about 3,000 pounds per square inch to loosen it, and you'll never walk again. So we aren't going to do that. It's not a good idea, because when tendons stretch like that, when they loosen, they don't tighten back up again.
It's called a band for a reason.
It's a band.
Everybody's always
It's
like, I'm really
supposed to-
tight right here.
It's
You gotta
supposed
explain
to
that.
stretch and move. You can relax and loosen the muscles surrounding it and that connect to it and things like that, but it's not a very vascular piece of connective tissue, so it's just really not gonna spring back the way you think it is.
Do you guys get the patients that come in that know more than you?
Oh, of course.
Like, ooh,
All the
work
time.
on my hamstrings. I'm like, that's
your
excuse me?
quadriceps.
I
and
had
your
not.
someone
triceps.
say hamstring, and I was like,
Ooh,
bicep,
good.
but sure,
Bicep,
yeah, whatever,
but yeah, that
whatever you
works.
want to call it, just perfect.
Or the ones, you know where the teres minor is, right? And I'm like, I do. Do you?
Yeah.
Yeah.
Do you?
Show me.
Show me.
Show me on the doll. Where did it hurt you? Where did it hurt you exactly?
I
you know?
think too, like a lot of times, like after like post-surgical patients, clients that come in, and it's like, I mean, you have an idea. Obviously, I'm not a surgeon. I don't know the exact cuts and things that they make, but it's like you know, if I have a full knee replacement, they have to take that
out.
Right. So they are removing.
They're cutting muscle tissue.
Yeah. So when you have clients that are like, oh no, that didn't happen.
They didn't cut any of my muscles. We were like,
I'm pretty sure they did.
Pretty sure.
I'm not saying that they cut it short. I'm just saying that they had to take it off.
Right. And then put it back on, and that there's nerve damage from that. And things take a time to heal. Yeah. That was the other thing we were talking about. Was, time frames for healing and things like that. And like, we know a lot of stuff. Trust me, we've been doing this for a really long time. Like, we know a lot. We're not doctors. We don't take the place of doctors. Quit asking me if something looks infected. Quit asking me if I think it's contagious. Quit asking me if I think you need an MRI. No, go ask your doctor. Yeah. I can't order one.
Or even like chiropractic stuff, and they're like, "Oh, do you think like I have a bulging disc?" I'm like, "I don't know. I'm not a chiropractor."
No, and even then, it's like I'm still pretty sure they have to refer you to an orthopedist. Like I'm pretty sure they have to be like. You're going to have to, I'm going to send your x-rays to this person who can actually diagnose that, and that's the thing is like, we are not allowed to diagnose in our field. And, the post-surgical stuff and everything is all the time. Does that feel normal to you? I didn't know how you felt beforehand, so I don't have anything to compare it to. Does this feel really tight to you? It does, but again, I don't have anything to compare it to if I've never worked on you before. Yeah. So, and it's not a dumb question, but it's a question without context. And so when I go to answer a question without context, I have to like ask more questions. And when people treat me like an idiot because I do it, I kind of want to smother them in the table.
This move is called the
yes. This is called the murder mitten sleeper hold.
There's nothing you can do to help me. Nothing. Oh yeah,
I'll bet.
Okay,
you can't hurt me.
Got it. Oh,
bet.
Oh, yeah. Okay,
bet.
Yeah, that's probably my favorite.
We don't want to. But I mean, challenge accepted. I mean, if you want me to. TikTok challenge. It's the new TikTok trend. Yeah. You can't hurt me. I will make you cry.
How much you want to put on that?
Yeah, right?
Like, I can't hurt you. Well, please don't ask me to.
Yeah.
I'll feel bad about it afterwards if I make you cry.
I mean, not really.
I do like this saddle chair. I do.
I'm a fan. Get them for the office.
Yeah. Right? So what do you think about the chair, by the way?
My back's good. My legs are a little sore.
We have saddle chairs here in the office. And
I sat down and I was like...
They're supposed to help your back. And Amanda was super freaked out because she's like, I feel like all spread-eagled and weird. And
a lot of pressure here, but my legs are here.
But now
my back feels great
for a while and you're like, oh,
yeah,
it's supposed to help your back.
You're lucky because obviously your tables adjust to the
they
person.
high, low.
Yeah, we need electric ones. Yeah. I'm working on it, all right?
Well,
like they're pretty costly. I'm working on it, but
it's great because
oh yeah, I wouldn't be able to do what I do all day long
100%. The proper tools. All of the tools.
The proper tools.
All of the tools.
We are the tools. So, well, these guys. Thank you so much for joining us, Amanda. We are definitely going to have her back because she's fun.
This is fun.
But if y'all have any questions for us, for Dr. Amanda, definitely, check us out on our Facebook page. Check us out on YouTube. You can also find us on
Spotify.
Yes.
And iTunes.
She
struggles with that every time.
I do every single time because I don't really use them.
I'm
like, and that's on you, Miss Stronghand. Yeah. Also, if you want to make an appointment with us, you can always go online to www.massagemechanicsSC.com. If you want to check out Midlands Family Chiropractic, where can they find you?
www.midlandsfamilychiropractic.com. We're on Facebook as well. Fantastic.
I like it. Yeah. And we'll absolutely share this podcast on y'all's Facebook page if you want.
Oh, yeah.
If you want. That's totally up to y'all.
We'll put this bad boy on our website.
It's one of those things where you're like, is this appropriate? Yeah. Yes,
Clients
it is.
Are like,
it always is.
I didn't know I could queef there. She's going to have like an influx.
I love it. So definitely like us, subscribe, follow us, send us all your crazy questions, and let us know if you are one of those people that likes to breathe through your anus with various things in it. How do you get those things up there? That's just and why?
Questions
we have a lot of questions. Questions of the day. All right, so we're gonna go and work now. So bye.
Bye.